Hey, I wanted to talk to you today about pelvic floor dysfunction and whether chiropractic care can help with that. So pelvic floor dysfunction is something that unfortunately affects a lot of people, specifically more frequently women. So if you're wondering, how do I know if I have pelvic floor dysfunction? Some symptoms you're going to be pretty aware that you have, unfortunately, and many of us do. It's more common to have some pelvic floor dysfunction than to not have it in most cases, unfortunately. So these can be things like pain in your pelvis area that radiates to your groin, abdomen, or back. This can be pain during sexual intercourse. This can be some urinary incontinence. So even if that's cough, sneeze, laugh, jump, and you get a little bit of incontinence or complete loss of bowel or bladder function. This can be burning, dryness or itchiness around the vagina, painful periods, excessively painful, and then just difficulty going to the bathroom, constipation, things like that. So these are not exactly glamorous things to talk about, but they do affect many of us. This, in extreme cases, can also lead to organ prolapse, so even bladder, uterine, or vaginal prolapse. So many times, I think we just feel like we are a victim of what's happening to us in our bodies. Like, well, I mean, yeah, of course, I go to the bathroom a little bit every time I sneeze. I've had babies, so that's just me. Or, well, yeah, I mean, I'm over the age of 65, so a prolapse is bound to happen. And unfortunately, this doesn't have to be the case. And I think that the most important thing is to start dealing with this is, one, to understand what's going on, to learn about your pelvic floor, to learn about your core muscles and how your pelvic floor is actually the bottom of your core. Your diaphragm is the top of your core, and how to activate these muscles. So there are products that can even help you learn how to activate your pelvic floor muscles. I'm sure many of us have heard of doing Kegel exercises, and those are very helpful. But it's not just about that, and we often forget to do that, or we can't even tell if we're doing it right, and we don't know what it means, and we don't want to talk about it because it's weird, or taboo. So we just kind of ignore it and go on with our lives having these symptoms that are very uncomfortable and affect us in a lot of really unpleasant ways. So one thing that I would encourage is to, one, learn about your pelvic floor, learn about your core, learn about what it means to activate your pelvic floor. And then, yes, chiropractic care can help with pelvic floor dysfunction. The nerves that come out of your sacrum and your low back, so your sacrum and your low back are down here. Nerves that come out of that area of your spine, they go straight to your reproductive organs, to your bladder, and to your pelvic floor. And oftentimes, for instance, if you're one of those people that struggle with constipation and being able to go to the bathroom, one adjustment can start to resolve that. If it's a matter of prolapse, then you're going to need to do a little bit of exercises and maybe some abdominal organ massage and work too. But thank you, Elise, for commenting. She said, finally, a doctor that cares about women's issues. It's so true. It aggravates me to no end that these are things that we don't talk about or confront. God forbid somebody says vagina on Facebook. Am I right? But hey, it's a very serious thing, and it affects, like I said, most people. So a chiropractic adjustment is going to start to, if you have any kind of impingement or anything that is keeping you from functioning from the waist down in your spine, it's going to affect how you move. It's going to maybe give you pain. It's going to maybe give you some of these pelvic floor dysfunction symptoms. So getting adjusted, stretching and strengthening, doing some physical therapy exercises, some abdominal massage or manipulation of those organs and the fascia and connective tissue in there. All of these things can help quite a bit. But it also, like I said, really helps to understand. So a quick plug, we are doing an event on pelvic floor dysfunction this weekend. It's going to be a workshop in Cleveland Heights at the Somatic Center. This will be led mostly by the Sara of the Somatic Center. And so I really like her. She's another Sara. I can trust other Saras. But then I also really like that she ties Pilates and dance and mind-body connection and all of these important things in together into what she does. So we've decided to partner up, and I'm going to give a little talk there and show people a little bit of self-care that they can do to help improve their pelvic floor functioning. So we would love to see you there. There's a link to the event on this post, and you can just go there and email Sara to register. We do prefer pre-registration. The event costs $25, which is pretty much nothing for all the wealth of information you're going to learn about. So please, if you have any questions in the comments, let me know. I'd love to answer them, and come find out how we can best help you with whatever you might have going on that has to do with the pelvic floor. Have a good day. Thanks.